When we take on any kind of pet, there's always preventative care that they need, and ferrets are no different. And actually what we want to talk to you today about is neutering. Now you might ask, why would I want to neuter my ferret? And that's a very good question, and it's different for boy ferrets, Jacks, and girl ferrets, Jills. Now in the boy ferrets, you would consider neutering them, getting them castrated, because it reduces their smell, so male ferrets can really be quite smelly, but it also improves their behaviour, their temperament in a lot of cases, so they become easier to handle, and they're also better with other ferrets. But within female ferrets, it's even more important to get them neutered. So ferrets are what we call induced ovulators. So when they come into heat, when they come into season, the female ferrets will stay in season unless they are mated. Now, that's not a problem in things like cats, it's just very annoying, they make a lot of noise, but actually in female ferrets it can be fatal. So the estrogen levels, the level of the female hormones in the body, they build up and up and up when they stay in season, and it can cause clinical signs like hair loss, but actually it can also damage and destroy the bone marrow, and they stop producing red blood cells, and they end up being very anemic, and it can be fatal. So we don't want our females to stay in season. Now we've got a couple of options about what we can do in female ferrets and a few in male ferrets too. So option number one is to use what they call a teaser male, a vasectomized male. That's where you take a male ferret and you have him vasectomized, which is where they separate the little tube that carries the sperm from the testicles out. Now that means that they can't reproduce, they can't cause baby ferrets, but they can still mate. Now they'll still have the problems of normal male ferrets, so they'll still smell and they'll still be a bit aggressive, but it does mean if you've got one of those and several females, that it can bring all of those females out of heat. So some people go down that route. Obviously if you haven't got a male ferret, or you don't want an entire male ferret, that's not for you. Option number two is what's called the Jill jab. Now this is what we used to do all the time historically, and the Jill jab is a hormone injection that we give every time they come into season. It takes them out for the year. Now we don't do it so often anymore, and it's a very large bottle of drug, and it's actually now incredibly expensive to buy in, and usually most veterinarians, if they draw up that drug, they won't use it again, and so they'll have to use that entire bottle for just one ferret, because nowadays we have to throw away the drug if it's not used within 28 days. So obviously if we're only using it for one ferret, that makes it an incredibly expensive way of doing it. So the Jill jab, not really in favour like it used to be, unless you're seeing a lot of ferrets. Option number three is to get them neutered. So that would be ordinary surgical castration or ordinary surgical spaying. So you can spay them, you can castrate them exactly the same as you would do a cat or a dog. Slightly different procedure, but they can have the surgery. Now obviously that's a great way of doing it. It works out relatively cost effective, and obviously it lasts for life. But there is a downside to surgically castrating or neutering our ferrets, and actually a lot of them will go on to get adrenal disease later in life. Not all of them, but a significant proportion. Now, adrenal disease is when they end up with a tumour on their adrenal glands as a result, we think, of being neutered. So the brain tries to stimulate sex hormone production, but obviously you don't have your testicles, your ovaries anymore, and they can't respond. So the brain keeps producing more and more of this hormone, trying to make you respond, and the end result, we think, is this adrenal tumour. And these adrenal tumours cause all sorts of problems in our ferrets. It can make them bold, lethargic, they can have all sorts of problems, and it can even be fatal in a lot of cases. Can be difficult to treat, although there are treatment options out there, but it's just something you need to factor in if you go down the surgical route. So the fourth option, and it's the one that we would recommend here at the clinic, and actually we had a couple of ferrets come in recently for this, and this is where you place a hormone implant, a little microchip if you want, under the skin that slowly releases a hormone over kind of 1 to 2 years depending on the size of the implant that you use. And that implant will bring them out of season or stop them coming into season. It also works for male ferrets and castrate them too. Now the downside with this implant is that it can work out more expensive over the course of your ferret's life, because they have to have it done repeatedly. So it only lasts a couple of years, and then they need to have another one placed. Now in a lot of ferrets you can place it conscious, but in the ferrets, as you see in this video, we actually gave them a bit of anaesthetic because they can be quite nippy, these ones, and obviously if you've got a ferret and you're putting an extremely large needle into them, they can be a bit grumpy about the whole thing. But side effect wise, so far this seems to be the best way forward. It's a relatively new product, so obviously over time that opinion might change, but right now it seems to be the safest and most effective way of doing it, although there are costs involved. So multiple options out there, certainly worth doing your research and speaking to your vet about it, but I hope that's useful for you.